Next up, we have Alex from Blue Ocean Technologies. Using a lab-on-chip platform, Blue Ocean Technologies is bringing critical diagnostic blood typing capabilities directly to the point of care where minutes can save lives. Alex, over to you.
Thank you, Mobin, for the introduction, and good morning, everyone. I'm Alexandros Klavounos, and I represent Blue Ocean Technologies. I'd like to dive straight into our topic. A lot of us probably already know the 911, what's your emergency, but what does really happen after that? If we take a look at what happens in a hospital, every 2 seconds, someone in the US needs blood. But that, sorry, because the advancing was weird. Sorry. The average red blood cell transfusion, however, is only 3 units under normal circumstances. In an emergency, however, more than 3 units are required per hour, which means that the doctors need to have a first line of response, which tends to be the generic or the universal blood group O. As a result, that puts a lot of pressure on the blood banks, which experience long-term shortages of these universal blood groups. After interviewing with doctors at the emergency, we identified two core issues. There is a need for rapid monitoring of patient status, while there are no reliable and easy-to-use portable blood analyzer that would fit that need. Here's where we come in. With Insight, we bring the accuracy and reliability of batch analyzers to the bedside with a small and portable instrument that can be deployed right next to the patient. Insight is fast, fully automated, portable, and one platform that can be used to develop several tests without the need of changing the hardware. To date, we have secured our application on performing agglutination right onto our system, which allows us to perform blood grouping, hematocrit, and other tests. We have developed several prototypes. Some of them have been deployed at our partner hospital, Sunnybrook, and where we performed 2 clinical studies. And the hardware that you see here was developed and designed by our recently acquired subsidiary, Cybots, which we were fortunate enough to have alternative funds that allowed us to move forward with our purchase. And lastly, we have been looking into expanding our assay portfolio with assays such as clot monitoring that allows us to look for coagulation factors. And we also plan to expand further our assay portfolio into chemistry and electrolytes that all complement the needs of emergency. Inside our instrument, there is one disposable microfluidic cartridge that you see here. It has the size of a credit card. This cartridge allows us to automate all fluidic operations, including move, split, merge, and mix. And all of them, most importantly, are dictated in the software, not the hardware anymore. What you see here on the right is actually reagents and human whole blood dispensed, manipulated, merged, and mixed, all in an automated fashion. At the top is the software that sends the instructions, and at the bottom is a real-time view of the chip. This is an agglutination reaction, so at the last step, our system will capture an image and analyze the result, which using our AI algorithm is going to process it and return an agglutination score. Insight has been clinically validated in 2 different settings. The first one was a clinical study performed at Sunnybrook with a pilot of 24 samples that were in complete concordance with the gold standard, and a second challenge study with over 130 samples, primarily comprising abnormal samples such as hemolyzed, rouleau, lipemic, enteric, and mixed field, that combined with our new AI algorithm that we have been developing, that allows us for a 4-level classification, which is practically the gold standard for agglutination, it came in exact concordance with the gold standard as well. Looking at the competitive landscape for agglutination is primarily dictated by large batch analyzers with some semi-automated uh, options here at the bottom that you see. The main issue of this is that they're too big and too slow for emergencies. While there is only one portable solution, which is often referred to as the Eldon card, however, this is 100% manual and depends on the interpretation of the operator. So this is the space that we fit in. We bring the automation of the larger instruments down to the semi-automated and manual category, offering a more reliable and faster solution. Our customer business model comprises of three parts: a one-time purchase of the instrument, and recurring revenue arising from consumables as well as SaaS and technical support. And we plan to enter the market firstly by targeting hospitals, which in the US they are more than 6,000 locations. But in parallel, there are small clinics, military and remote care, as well as private practice, including animal care, that we can continue to explore. The point of care market alone is estimated to be more than $48 billion, and this will continue to grow. And a fraction of that, which is emergency testing, is about 30%. Now, if we look at our first market, which is blood grouping, it starts with $2 billion, and we expect to start from North America, which at the top level, it is going to be a market of 630 million today. Lastly, I would like you to meet our team. I'm Alexandros Klavounos. I'm CEO and co-founder of Blue Ocean Technologies, but I couldn't do this alone. I'm joined here by some wonderful individuals spanning across a vast stream of expertise, from marketing to analytical chemistry, as well as some wonderful advisors with either past experience in startups or deep expertise in our space, which is transfusion. Looking forward, so our work plan is to finalize the hardware and software development of our platform, continue training our AI model and validate it in our vast data set of images that we have acquired, and begin a multi-site clinical study using partner hospitals. In order to get to the next step, however, we are looking for a 5 million seed round, which we will be opening soon, and that will allow us to collaborate with more Canadian and US hospitals, initiate our regulatory pathway, and then get us into 2028, which we'll be looking into entering the US market and add more assay panels into our system. Thank you so much for your attention today. And remember, blood testing is necessary to guide medical decisions, but current workflows require a lot of time to generate results. Here is where Blue Ocean Technologies revolutionizes the space with a point-of-care system that is fast, portable, and reliable. Thank you so much.
Fantastic, Alex. Thank you very much. We're opening it up to questions. Feel free to add your questions to the chat. I know initially we said Q&A, but it's better if we can all have our questions in one source. So feel free to put them in the chat. Alex, we have a question for you. And the question is, who will run the instrument at the bedside?
So our workflow is rather simple. You load a small amount of blood onto our cartridge, our disposable cartridge. Then you input it into the instrument, and then the instrument is the one that runs the test. Who will be responsible from the medical team? That can be done practically by anyone. Usually in cases of emergency, There aren't that many available hands, but due to the simplicity of our system, anyone can simply load the cartridge and press play. Everything else is practically taken over by the instrument. With our first prototype, we started from 8 minutes. During the second clinical study, we brought it down to 5, and now we are almost at the 4-minute mark for the entire workflow, including the sample introduction.
That's great. And we are at time. So Alex, thank you very much for your presentation and taking the questions.